Dr. Ajoku Amadi Obi. You're welcome to this segment.
Thank you.
All right, let's begin this way. Looking at the Nigeria healthcare sector, how would you assess us in terms of infrastructure, human capital, and of course service delivery?
The challenges in the healthcare delivery field in Nigeria is quite enormous because of decades of lack of investment in the infrastructure. So basically now there's not a lot of infrastructure development that has gone on. So at the moment, if you're doing any healthcare projects, you'll have to build everything from the ground up. So anybody getting into that field at the moment has to be self-sufficient and be able to sustain whatever he's able to do within his own environment. So the challenges are multifarious, but the best way to approach this is to be able to look out for all the other obstacles that you will obviously encounter when you're working within this environment.
What is the Undibia app all about?
It is really designed as a digital health assistant. So it has many facets and features that basically allows you to have a fully featured healthcare solution in the palm of your hand. A couple of the feature set you see on the app will be in terms of creating awareness about various medical conditions. We have a feature that gives healthcare advice. And as per the Nigerian environment, there are people who are not able to read. So if you put it on an app, they might not be able to see it or read it. So it's translated into 3 major Nigerian languages, and we'll be going further on to translate it into more, depending on take-up. So you can go to the marketplace with somebody who is not really understanding a particular language, and you can read it in Yoruba for them, and the app will just read whatever it is, information you have on that system.
Now, let's bring it home to the man on the street and, of course, our audience, our viewers. Now, are you saying that this is an application that can directly, without maybe a middleman, a go-between,
yes,
access direct medical services, get medical advice, and get disease alerted? Please
without
throw more light.
Yes, for the man on the street, yes, those features you mentioned are actually quite ideal for accessing medical care in various forms. But there are features there that are particularly developed for the man on the street in Nigeria. For example, now, a lot of us have relatives in the US that sometimes have to pay for their medical care. So a situation where somebody's mom is in Lagos and they get sick and they need a medical doctor. Anybody in diaspora, in the US, in the UK, can just pick up their smartphone, access a medical doctor, pay for the health care, and decide on whether the doctor will go to your mom's house or your mom will go to the doctor. These are all options. Or even if whatever it is not treatable in their particular environment, whichever local doctor saw you can actually refer you directly on the app, and you'll be able to access a second opinion from anywhere in the world. So in that way, it accesses and gets healthcare, optimum healthcare, directly to the masses. So now the system is very flexible and adaptive. So there are features that you could very easily use in situations where, like I said, like the meningitis outbreak. You can directly use the app to go to particular regions. Now, I am mindful of the fact that many places don't have internet access. So there are features within the app that you can use without having internet access. So, like if you want to reach a large proportion of people and in that area there's no access, you can download some of the features on your phone, and the healthcare workers can go to those areas and actually use those features.
As we wrap up, Dr. Ajoku, where would you see Nigeria's healthcare service delivery, telemedicine, and in, say, 5 years or a decade from now?
I think there are changes that are being within the system at the moment that will dramatically change the way we use healthcare. There are a lot of the people who are in policy holders now who have only started making the changes that will be necessary to lay the groundwork. So I think a lot of factors are beginning to coalesce so that there will be marked improvement in healthcare delivery within the next 5 years, I would say. Yes.
It's been a pleasure having you on this segment of DigiVation. Good to have you.
Thank you.